Assalamu alaikum, dear diploma examinee. So, welcome to episode number 3 for Rush to Success. So, Rush to Success is a very special session, and today we are starting with a clinical scenario and hope it will be very much beneficial for you. So, the scenario goes like this: a 37-year-old female came to you with severe respiratory distress in emergency department. You have done chest x-ray, ECG, and chest x-ray is completely normal. ECG shows sinus tachycardia with right axis deviation, and on query you have found patient have traveled for 3 days in aeroplane and came to Bangladesh from USA. So what is your diagnosis? So this is a very interesting session, and this is a very interesting scenario which we commonly face in our SBA exam or SBA questions. So single base answer, you must look for the special point that will guide you towards the diagnosis. In this case, the diagnosis is pretty clear, right? This is pulmonary embolism. So pulmonary embolism, this is one of the most important topic for Diploma SBA. So let's talk about pulmonary embolism. So pulmonary embolism, first, how it is created. So in pathology, there is a good saying that 99% of embolism comes from a dislodged thrombus. So in the scenario, you have found the patient was traveling for 3 days in aeroplane. So there is a very good chance of developing deep vein thrombosis, DVT, or there is a chance of forming a thrombus in the leg. This thrombus gets dislodged and comes to our pulmonary artery, and it blocks the circulation and results in pulmonary embolism. So in the scenario, what are the points that goes in favor of your diagnosis? First of all, in pulmonary embolism, there is very slight chance of any chest x-ray findings. In chest x-ray, usually there is oligemic lung field and wedge-shaped consolidation, but that's further or more progressed findings in chest x-ray after pulmonary embolism. So most of the cases, the chest x-ray is completely normal, and in ECG, you have found there is sinus tachycardia and right axis deviation. So these two are the most important findings you will get in ECG. And another is S1Q3T3, but to be fair, it comes really late from the onset of the disease. So sinus tachycardia and right axis deviation are very two core features for pulmonary embolism. So in pulmonary embolism, what are the important SBA you must know? First of all, you have found the findings. Second, what are the symptoms? Patient comes with severe respiratory distress. Another is there may be some chest pain. Okay. And in examination, there are no specific examination findings, but there may be features of DVT, that is unilateral leg swelling. Okay. And there may also be a history of DVT. Okay. After sign, let's go talk about the investigation. In investigation, the primary investigation, you go for radiology, right? So radiology, chest x-ray is completely normal, or sometimes I have already said there may be wedge-shaped consolidation and some oligemic lung field. In CTPA, that is pulmonary angiogram with CT scan, it is the gold standard for the diagnosis of pulmonary embolism. This is very important for SBA. But if the scenario contains a pregnant woman, then you cannot approach with CT pulmonary angiogram. Then you have to approach with VQ scan, that is ventilation perfusion scanning. Okay, so these two you have to remember. One is CT pulmonary angiogram, that is the gold standard, but if the patient is pregnant, then you must approach with VQ scan. Okay, so management basically needs a loading dose of low molecular weight heparin, about 60 mcg subcutaneous 2 times daily, and then we switch to oral therapy for warfarin, right? So that's all for today's. This scenario is very, very important for SBA. Must keep in mind, and hope the video liked and video is liked by everyone, and please do share and share your feedbacks regarding the video. Assalamu alaikum.